Hi, everyone. My name is Maggie Cameron. I'm the Communications Manager for the Desmoid Tumor Research Foundation. Dr. Kelly Mercier is joining me today to talk about the DTRF Patient Registry and Natural History Study, what they are, why they're important, and for those of you who already have a profile in our patient registry, retaking versus updating your surveys. Dr. Mercier is the principal investigator for the DTRF's Natural History Study. She is passionate about desmoid tumor research and thrilled to be able to contribute her own expertise and scientific knowledge to a better understanding of desmoid tumors. Kelly, thank you so much for being here today.
Thanks for having me, Maggie.
So before we dive into retakes versus updates, can you give us an overview of the DTRF Patient Registry and Natural History Study and how they relate to one another?
Yes, and I know this question has come up a few times, so it's good that we discuss this. So the DTRF Patient Registry is a platform for which you can sign up to get information about studies that are available. So the platform, the registry, enables studies such as the Natural History Study. The DTRF Natural History Study is the way for which we collect patient-specific information about the course of their disease. So from symptoms to diagnosis to treatments to monitoring, quality of life, financial considerations, pediatric considerations, all these things, comorbidities, right? All of these things encompass your life, right? And we want to know every aspect of your desmoid tumor experience. So that's what's the Natural History Study. And we come back to you at least once a year to ask you some of the questions again, check in on you. Some we don't ask past that first time.
So it's a study over time. So it sounds to me like these periodic updates of the information that a registrant has entered become pretty important. We've been pushing out a lot of messaging lately to asking people to retake their surveys. Can you talk about the difference between retaking versus updating and why we're asking everyone to retake surveys now?
Absolutely. So for the past year and a half, we've been refreshing the study. So we have heard feedback from our researchers. We've heard feedback from participants, patients about what questions that they still have about the disease, what we're not doing a good job asking, what we need to readdress. And we've taken this past year and a half to totally refresh the study. Now, what that means for the participants is that, one, we've heard you, right? We've tried to customize the study to better address questions that patients and their families have, shortcomings that the researchers have identified, and we've included it in the study now. The challenging part is we need you to retake the studies or the surveys that you've already taken, because we've added so much more. So the difference between retake and update, super important question. So when you want to see new questions, you have to retake things. When you want to update something, you're going to see the same thing that you took last time. So if you have no surveys that you have taken ever before, you are new to this, thank you, first of all. Welcome to the community. You will have a fresh slate for you to take all of the surveys for which you are eligible. If you start today, all of the new surveys are going to be in there. The next time you go in, you can do an update. And what an update will get you is all your previous answers. So you don't have to recall what you put in before. This is important. I don't know about you, Maggie, but as I'm getting older, I have a hard time remembering details from like a year to 5, 10 years ago, right? So, and some of our participants have had desmoid tumor for 20 plus years. I don't want to ask the same questions. I don't want them to have to remember the same amount of detail 20 years later, right? So when update is available, it's very powerful because you can you change the things that have changed since the last time you took it. However, since we've made all of these changes, we've taken all this feedback, we really need people to go in and retake, because you're going to see the new questions. You're going to see how we're asking them differently. Some of the questions, you're going to see new questions. You're going to see new surveys. So it's important that at this moment, if you have already had a profile in there, you've taken the surveys before, please go back and retake, because you're going to see all of the work that people have put in over the past year and a half. The two surveys that we just added, so they're fresh for everyone, is a caregiver burden and a financial burden. So because, like I said, this is like a chronic disease. Mm-hmm. Having those two things documented for this rare condition is super important. There's no other surveys that are looking at financial burden for desmoid tumor. They're not. And we have a worldwide study that is going to be able to give us information. No one else is asking questions about caregiver burden for desmoid tumor patients, but we know that there are a lot of desmoid tumor parents out there. And so we want to know what is it like for them, and how, if we learn something, can we translate that into a separate project to help enable support?
Yeah, that's a really great point. When I'm thinking about all of the sort of more clinical questions, the medical questions, I assume this data is then going to be used by researchers to try to find better treatments, work towards a cure. Is that sort of the ultimate goal of some of the clinical questions?
It is. And so we have a lot of clinical researchers who are co-investigators on the natural history study. We talk every few months about data for which we can interrogate for different questions. One of the questions that we're considering is time to diagnosis for desmoid versus, perhaps other sarcoma. Other questions can be around efficacy of treatments for hormonal therapies. Typically we haven't seen good responses, but there are patients out there that do have a response. So what are the clinical characteristics of those patients? So trying to understand these nuances with the researcher clinicians is going to be very important. But we can't answer these questions without people's data. Right. So this is why when you have any kind of treatment change, if you have surgery, if your quality of life improves, I want to hear about it. So you can go back in, and that's the time when you can do an update your survey.
Great. Well, this was really helpful. I was certainly a little bit confused about the difference. So you definitely helped me understand the difference between updating versus retaking, and the fact that there are so many new surveys and questions in there that the retakes are really important right now. So thank you for your time today. Really appreciate it. So to the community, if you could please set aside a little bit of time to retake these surveys. And again, I want to reiterate that you do not have to do it all at once. You can save and come back. It can be probably a little bit overwhelming to kind of go through everything again. So take your time with it. You can find your surveys at dtrf.imrare.org. And then we also have information on our website, which you've probably been to a million times, but dtrf.org/patient-registry. And I think that's all we have for today. Thanks, Dr. Mercier. Appreciate it.
Thanks, Maggie.
Thanks.